Today we're going to talk briefly about plantar fasciitis and inflammation. Specifically, doesn't the plantar fascia get inflamed? There was a time when I thought so too, until I did a thorough literature search and found out otherwise. There are several reasons for this popular misconception, and a big one has to do with the way people are typically diagnosed with plantar fasciitis. For instance, most people are commonly told that they have plantar fasciitis based on several things. The symptoms they are having, like heel pain, hurts with the first few steps in the morning, the results of their physical exam, pain on the bottom of their foot when pressed on, most often in the heel area. Nothing else obvious is going on, so kind of a diagnosis of exclusions, no broken bones, that kind of thing. As you can see, we really have no nifty little x-ray or lab test doctors can run that will tell you that a patient definitely has plantar fasciitis. Furthermore, none of the above things that are commonly used to diagnose plantar fasciitis are really proof positive that there is indeed inflammation present in the fascia. And so we don't have any definitive tests for plantar fasciitis. People who are told they have this condition automatically assume that their fascia is chock full of inflammation. But is this really the case? Well, if we approach this matter scientifically, to say that something is inflamed means that we should be able to find some hard evidence of inflammation. Without getting too caught up in details, inflammation can be broken down into two general patterns, acute and chronic. Okay? Here's the difference between the two. Acute inflammation is an immediate and early response to tissue injury. It comes on quick, lasts for minutes, hours, or a few days. Neutrophils are the major kind of cells that are involved in acute inflammation. Chronic inflammation, on the other hand, is inflammation of a prolonged duration, such as weeks or months, in which active inflammation, tissue destruction, and repair are all going on at the same time. Some of the major cells that are involved in chronic inflammation include macrophages, lymphocytes, and plasma cells. It's not important to know all about these different types of cells, although you may be interested to know that a lot of them are simply different types of white blood cells. What is important, however, is to know that these are exactly the kind of cells we should be able to find in people with plantar fasciitis, if the fascia is indeed inflamed. Since these are the cells directly involved in the body's inflammatory process, so now that you know this, let's see what the researchers have found. So this book has compiled all the studies as of when it was written. And they looked at the studies, the number of samples, the duration of symptoms, and the major histological findings. What this table represents is the results of a literature search I did one time when looking for all the studies that took at least 10 people diagnosed with plantar fasciitis, removed a piece of their fascia, and looked at it under a microscope. And as you can see, it doesn't look like researchers have reported findings of many of the cells that are directly involved in the inflammatory process. Therefore, without some cellular proof of an inflammatory process, one has no basis to accurately say that the plantar fascia is indeed inflamed when one has plantar fasciitis. The point, inflammation does not appear to be a major feature of plantar fasciitis, especially in patients that have been suffering with this condition for many months. Studies do, however, consistently find evidence of degenerative changes in the plantar fascia. So if you've been treating your inflammation, you're treating the wrong thing. So anyway, that's according to the research.